Hi, I'm Hayley. I work at Trinity Court Surgery in Stratford and regularly cover extended access shifts at both Trinity and Waterside hubs. You may not know much about clinical pharmacists as we're fairly new in the general practice team, and some practices may not have a clinical pharmacist on board yet. I'm going to tell you a little bit about me and a bit about what sort of patients we can help in the extended access service appointments. I graduated in 2003 from the University of Bath with a Master of Pharmacy degree. I then went on to do a pre-registration year in order to become a qualified pharmacist in 2004. Since then, I've worked in a variety of roles in community pharmacy, education and training at the University of Manchester, and in general practice. I obtained my independent prescribing qualification in 2016, and I started to work at Trinity Court Surgery as a practice pharmacist later in that year. All pharmacists have varied pathways into a role in general practice, but everyone working in the current service is a fully qualified pharmacist with an independent prescribing qualification, so the same as me. All of this means that we can prescribe all medication, we can check blood pressure and peak flow, we can discuss medication side effects and can resolve medication queries. The pharmacist's role in extended access is to deal with routine medication reviews and medication queries. Patients who are acutely ill are best seen within the practice or by a GP or ANP in extended access. So what kind of patients are appropriate for extended access appointments? People who have stable long-term conditions and need a medication review. Anyone who has a query regarding their medication or prescription or any side effects that they may be experiencing. If a patient has recently been discharged from hospital and has questions regarding their medication, we can also help. If you book them in for a face-to-face appointment, then please advise the patient to bring their discharge paperwork and medications with them. We can also see patients for face-to-face contraceptive pill reviews. So what does this mean for your practice? So if someone's constantly running out of their medication and frequently calls a practice, why don't you book them in for a telephone consultation with one of the pharmacists at Extended Access, and we can help resolve their problems. There may be patients on multiple medications who may be seen in practice for some acute problems. Your GPs may not have time to run through all the medications with the patient. We can go through these medications for you, thus taking the pressure off your GP team and allowing you to deal with the other patients in the waiting room. We regularly look at patients who have 20 or more medications, discuss how they are using the medication and if it's still needed. If during the medication review we identify that any routine tests are required, we will let the practice know through EMIS. This means that your clinical team within practice have a reduced workload as we've done the review for you. And remember, this is all clearly visible and coded on your EMIS system. Because we code, this means that any QOF incentives will appear on your practice EMIS. We offer either face-to-face or telephone appointments. Just make it clear when you book the patient in which one it is. Even if you are based in a surgery 20 miles away from a hub, we can still help by having a telephone consultation with the patient. If you book a telephone appointment and the patient needs to be seen, then we can just book the patient into the next extended access slot at their nearest hub. Please do use the pharmacist appointments. They can really take the pressure off the practice and can offer patients convenience and choice.